Hello everyone, hope you all are doing well. The purpose of this video is to talk to you all about your clinical skills exam. So this exam is going to be happening on 31st of March, Tuesday. And I understand people might have lots of questions such as what exactly will be in the exam, what are the expectations, how will be assessed, what sort of clinical skills, etc, etc. I'll be talking to you all about all of those things. First of all, we will start at sharp 9 in the morning, and then you all need to go through series of stations which will be assessing your clinical skills with respect to the diagnostic audiology paper. So for roughly from 9 to 9:45ish, we will have a station where you all will be sitting in the lecture theater and you all will be responding to few clinical questions. So it'll be almost like a writing exam, but those questions will be very clinical questions related to pure tone audiometry, otoscopy, masking, tympanometry, acoustic reflexes. So you all will get exact same questions, and that way you all will be assessed fairly and objectively. Once you all have done that station together, after that, you all will need to do 2 more stations. First station after that will be about things like pure tone audiometry, uncomfortable loudness level testing, tympanometry, and acoustic reflexes. So all of these skills will be assessed together as one station, and another station will be about masking. So what I'm going to do now is I'm going to take you through about the details of these stations, what exactly is expected. I should also let you know the practice which we'll be having in the next few days' time. During those sessions, the clinical skill lab sessions, I will be passing on the marking rubric to you all. So you can exactly see what exactly is expected out of you and how you should be performing really, really well. Okay, so let me talk to you about the very second station, which is about otoscopy, pure tone audiometry, uncomfortable loudness level, tympanometry, and acoustic reflexes. You all will get 20 minutes to do all of these. I know, right? It sounds a bit scary, but trust me, all of these are very quick tests, and you will not be asked to do all of these things in detail. So let me read exactly what you're supposed to do. You'll be testing only 2 frequencies for air conduction testing and 1 frequency for bone conduction testing. Then you will move on to uncomfortable loudness level testing only at 1 frequency, and also doing tympanometry only in 1 ear, and also ipsilateral acoustic reflex only at 1 frequency. All right, so you all will be allocated a client or a patient, and then we will give you the instructions that this is what you're supposed to do, and off you go. And the examiners are going to be sitting quietly watching and seeing how exactly you're doing these things, okay? Few really, really important tips for you all. First of all, otoscopy is extremely, extremely important, okay? Make sure you do it before starting your pure tone audiometry, okay? That's extremely important. And while you are doing otoscopy, things like hand hygiene is extremely important. How you are sort of bracing the position, what is your sitting position or standing position, how you are holding the otoscope, all of those things, and most importantly, getting a consent from the client. These all things are extremely important, okay? Then once you move on to doing the pure tone audiometry, instructions are extremely important. And I hope by now you all know the instructions really, really well. So you need to make sure that the instructions are really clear, you have taken consent from your participant, and also when you're doing the pure tone audiometry, what is your starting level? But how you're decreasing the intensity and increasing the intensity, whether you're sticking to the Hudson-Wesley procedure or not, all of those are extremely, extremely important tips as well. Also remember to vary the presentation tone, duration, and style, and not to be giving any signal to the client that you are presenting a tone. All right. Once you have done all of those, then you'll be moving on to uncomfortable loudness level testing. One of the key components of this particular testing is while you're doing the testing, you must observe the client's facial expression while you're doing the testing. Okay, that's a very crucial step. Rest is similar to as recommended in the BSA procedures. After that, you'll be moving on to tympanometry, and again there, The instructions are extremely important. Finding the right size of the probe tip which fits the client's ear is extremely important. How you are pulling the ear backwards and upwards to put the probe in, that is also extremely important. The various parameters of pressure rate are extremely important as well. So make sure that you all practice all of those things as well. And also, when you're doing the acoustic reflex testing, there is a limit that you should not be going beyond 110 decibel level of presentation. And I hope you all know the reason why you shouldn't be. Okay, so we do have some of these as red flags, that if you forget to do otoscopy, if you forget to stick to this Huxley procedure, if you forget to follow the hand hygiene, if you're trying to cross beyond a certain intensity level which is not recommended, and also if you don't observe the client face when you're doing the uncomfortable loudness level testing, those will result into instant fails. Okay, so make sure you all stick to these procedures, and you will get an opportunity during the skills lab time to practice all of these things. And also I'll be talking a lot about masking in person. To sum it up, when it comes to masking, you all should be in a very good position to look at an audiogram and say, point number 1, whether masking is required or not. Point number 2, if masking is required, what is the rule of masking which is applicable here, and why that rule is applicable here? You should be able to justify that really well. And of course, after that, you should be in a good position to set up the initial masking level, the noise level, what should be the tone level, how you should be increasing and decreasing those to be able to get a plateau. Okay, with that note, I would like to wish all of you the very best for your clinical exams. Stay well, look after your health, and good luck for the exams. Take care. Bye.